going on, today we'll be discussing about the anti-Parkinsonism drugs. Okay, so what is this Parkinsonism? We discussed last class. What is this Parkinsonism? We discussed about RAT. What is the RAT symptoms? Rigidity, akinesia, and tremors. Okay, so which people will get this Parkinsonism? Young people or old age people? So old age people. So it is a disease of old age people. Okay, so what is that we are seeing in this diagram? Rigidity. So the person is not able to move his limbs. Rigidity is there. Then tremors. Okay, rigidity. Tremors are there. Then the person is having forward bend. Okay, this is partly due to the body bending forward due to rigidity of the muscle. Shuffling gait with short steps. Okay, because of rigidity, the person is not able to move his limbs. Okay, this is how the person of Parkinsonism will be there. Okay, what are the characters? So first characters we already know about rigidity, akinesia, and tremors. What are the other features we will be seeing? This is a chronic progressive motor disorder. Okay, so on the right hand corner I am putting photos of some people who are suffering from this. Do you know this person? Vatican Pope. Okay, so he was previously Pope who had the disorder called as Parkinsonism. Okay, so tremors, it is resting tremors. That means even though person is not moving his limbs, at the rest of the person will be having this tremors. Okay, so it's a chronic progressive motor disorder. Okay, characterized by tremors, resting, rigidity, cognitive rigidity. That means the cognitive. Okay, some resistance of the sound. That we call as cognitive of rigidity. Akinesia and also bradykinesia. Little movement, short steps he is putting, and postural instability. You saw the person posture is somewhat bent. So etiology, what causes this? One is age-related disease. But the patient can have genetic environmental toxins, endogenous toxins. Okay, this can be due to two major pathological processes, that is misfolding of proteins and mitochondrial dysfunction and oxidative stress. Oxidative stress due to the dopamine metabolites, which are like hydrogen peroxide, which can get accumulated and cause this disease. Okay, do you know this person who was a boxer? Okay, so non-motor symptoms and motor symptoms. What are these symptoms we are having here? Behavioral, sensory, and autonomic. Okay, depression, anxiety, decreased motivation, and personality changes. Because of the disability the person is having, will have this disorder. Sensory, non-specific pain, restless legs, and sleep problems. Okay, all these problems are there. Drooling of saliva will be there. Urination will be there. Okay, he will not control his urination anymore. Okay, then constipation will be there. Urination, you can remove the clothes. What? How do you make the person defecate? You need to give some laxatives, the stools of food, so that he can defecate. Okay, that's the problems the person will face. Impotence, low blood pressure, all these things are seen. So what are the drugs which can be used? We discussed in the last class that the drugs which can be given are levodopa and pharmacology. Okay, so dopamine is a catecholamine. Okay, it cannot cross the blood-brain barrier, so it is given in the inactive form, that is levodopa. So levodopa can be converted to dopamine in the brain. Okay, so once it crosses the blood-brain barrier, it can be converted to dopamine there. Okay, so that is it. That's why we are using the dopamine precursor. So the dopamine is the one which is deficient here. Okay, so we already discussed something about the antipsychotic psychosis. Okay, schizophrenia. What is the drugs which is given there are which decrease the dopamine level. Okay, in antipsychotics we use the drugs which decrease the dopamine level. Here what we have to do? We have to give the drugs which increases the dopamine level. Okay, so that's the difference here what we are seeing. Okay, in Parkinsonism, dopamine levels are low. We want to increase the dopamine level. Okay, so here we are increasing the dopamine level. For increasing the dopamine level, we are giving the drugs which can be converted in the brain to dopamine. Those drugs are levodopa. Okay, Along with levodopa, we use a drug which can prevent the peripheral metabolism of this dopamine, that is carbidopa. Okay, so dopamine formation is in the brain. So we are using the primitive product of this dopamine, that is levodopa. So and also we are using one more drug along with this levodopa, that is carbidopa. Carbidopa is a peripheral dopamine decarboxylase inhibitor. So peripheral metabolism is inhibited so that it can go to the brain and get converted to dopamine. Okay, so that's it. Then the drugs which can release this dopamine, centrally dopamine is synthesized and this can be released with the help of the drug amantadine. Have you heard of this drug amantadine? Where you have heard? Yeah? Any antiviral drug? Which antiviral drug? Influenza, have you heard of it? Yes? Okay, so amantadine is the drug there. It also has this use also. Okay, so dual use drug. So dopaminergic agonist, that is bromocriptine. The drug which can act like dopamine is dopamine agonist. That is, they can act on the dopamine receptor and produce the effect similar to dopamine. That is bromocriptine, perchloride, decidide and droperidol. The drug which can inhibit the metabolism of dopamine. We have discussed something about this. Okay, MAO inhibitor and CYP inhibitors. Okay, so the peripheral dopamine inhibitors, those are MAO inhibitors such as salicylic and gastrulin. And CYP inhibitor, again CYP is an enzyme which metabolizes this dopamine. CYP is catechol-O-methyl transferase. It is an enzyme which metabolizes the dopamine. By inhibiting the enzyme which metabolizes it, we increase the dopamine levels. Okay, tolcapone and entacapone. So the drugs which influence the cholinergic system. Okay, here rigidity and tremors are due to the cholinergic side effects in this Parkinsonism. Okay, so cholinergic system in the brain is uncontrolled. Okay, in case of Parkinsonism, the cholinergic system in the brain is uncontrolled, so it can produce rigidity and tremors. So we have to inhibit this activity. How do we inhibit the cholinergic activity? We can give anticholinergic drugs. Okay, anticholinergic drugs are also called as antimuscarinic drugs. Okay, these drugs are benztropine, benzhexol and piperidine. Okay, so benztropine, benzhexol and piperidine. And also some of the antihistaminic drugs such as diphenhydramine, orphanadrine and promethazine can be helpful to prevent the drooling of saliva. Okay, you know small babies, they can drool the saliva out. It is also same with the elderly people where this Parkinsonism disease is there, drooling of saliva will be there. That is bad, no? That's why we need to use a drug which can prevent this drooling of saliva from the mouth. So here is the drug levodopa plus carbidopa. Levodopa is the inactive form of dopamine and carbidopa is the peripheral dopamine decarboxylase inhibitor. Still the best, especially for short-term use. The one demerit of this preparation is they are very short acting. Okay, that means after 3 to 4 hours of the drug, the patient will have again symptoms. So you need to give the drugs again and again, 4 times, 5 times per day. 4 to 5 hours means how many times you have to give? Per day. How many 4 hours are there in 24 hours? 4 6 are 24. So 6 times, 5 to 6 times we have to give. So it is difficult to do. That's why we need to add some drug so that they can act for longer duration of time. Okay, we need an alternative where the drug can act for longer duration of time. When we tell the patient to take the drug for 3 times, they will forget. How about 4 to 6 times? It is difficult. So we need to use a drug which can enhance the action. Once daily or twice daily will be helpful. So we need to add some more drugs here. Okay, so we call this phenomenon as on and off phenomenon. On means we are given the drug, it will act for some 4 hours. Off means the drug effect has decreased. Okay, so we call it as on and off phenomenon with levodopa and carbidopa. So long-term use, what are the demerits here? Motor fluctuation, dyskinesia, all these things are there. So the thing is, even though we have alternative drugs, ultimately most of the patients need this drug. low. Kinesia is movement. Okay. To help the patient in bradykinesia, we need this drug, levodopa, and also for the rigidity. Okay. So small dose increment is needed. Okay. We cannot give the high dose drug initially. Okay. So slowly we can go on increasing the amount of drug that we are giving. So do you know any drugs we start with high dose, then we go on decreasing the dose? It's the steroids. Okay, steroids first you need to give very high dose. Okay, then we have to go on decreasing the drug. Okay, that's it. And it is also same with the any drugs where we give high dose first, then go on decreasing the dose. So in case of hormone replacement therapies that are using. So adverse drugs, reaction, nausea, blushing, sweating and neuropathy. Okay, so as these are dopamine drugs, they can cause this nausea, blushing, sweating, neuropathy, all these things can be there. Treatment is on and off limit. We got to know what is on and off limit. So end of dose mitigation. So as long as the drug is there in plasma, it is working. Then just after 4 hours, again patient will deplete. So other drugs are dopamine agonists, the drugs which can act on these dopamine receptors and bring about the action. So dopamine receptors have different function in different parts of the body. Do you remember where we told dopamine can be given? Dopamine or dopamine, these are the drugs for cardiogenic shock. Okay, so artificially the dopamine we give in case of cardiovascular anomalies. Other than that, we don't use it. Okay, but we can use the dopamine agonists which can act on the central nervous system. Dopamine has different functions. Central nervous system, different function. On the heart, different function. Okay, just remember. Okay, don't confuse dopamine at different parts. Okay, that's why God has made different systems. Central nervous system, there is a gate there. That gate is blood-brain barrier. Okay, a drug which is given for cardiovascular use cannot go to the brain and act like that. Okay, before going there, we have some enzymes which can break down it, and also gates. That is blood-brain barrier. If you not allow dopamine to enter like that, that's why we are giving it in indirect form. That is levodopa. Okay, so levodopa is the one which can cross the central nervous system, can bypass this blood-brain barrier. Okay, and go there and get converted to dopamine and act there and has different mechanism there. What is that different mechanism? Keep the person in active form. Okay, if it decreases, what can happen? Parkinsonism. If it increases, schizophrenia. Okay, schizophrenia is auditory and visual hallucinations. You know what is auditory hallucination, visual hallucination? So these two girls are speaking here. One girl standing there will think that okay, they are thinking about me. They are cursing me like that. Okay, so that is schizophrenia. So the drugs which can act on the dopamine agonists are dopamine-related, pramipexole and pergolide. Okay, so bromocriptine, gabapentin are now avoided due to some cardiovascular and retroperitoneal fibrosis. Retroperitoneal. This around the stomach we call it as peritoneal. Retro means back. Retroperitoneal fibrosis. The muscles around this region can get fibrosed, no longer contract. So person will go for again short bend stature. Okay. So side effect profile is most of these drugs side effect profile is same. So less motor complication, but as such improvement will be less with these drugs. Anyhow, we can use a combination of this levodopa, carbidopa and one of these drugs, either rotenilol, bromocriptine or gabapentin. Why? We have to prevent this on and off pneumonia. Okay, on and off pneumonia, that is we use the drug more frequently. So what are the demerits of this dopamine-related pergolide drug? So demerits is excessive daytime slowness, sleepiness in the daytime. Okay, what happens after taking the class? Okay, see, hypotension. Okay, hypotension can occur. Good evidence of in advanced Parkinson's disease. Okay, so where we can give this trans protein. Okay. So in case of advanced disease, one drug which we can give is transdermal protein. Transdermal patch means something like a bandage sticker which you apply for wounds. The constant delivery of the drug will be there. Okay, why we need constant delivery of the drug? To prevent on and off dopamine. Okay, so that's it. So increases the dopamine agonist often versus the hallucinations sometimes. So these hallucinations sometimes can be aggravated. Okay, why? Because dopamine excess means schizophrenia. Low dopamine means Parkinsonism. So we need to follow a mid path. Okay. So if dopamine sometimes increases when we use it to treat this Parkinsonism, hallucinations can occur. Okay. So the demerits of this age-related diseases, you use a drug to treat Parkinsonism, you can get schizophrenia. And you use a drug which can cure the schizophrenia, Parkinsonism can occur because low amount of dopamine. So that's why we should not go for old age. So antiviral drug, that is amantadine. Okay, it is a weak dopamine agonist and can also act on this NMDA receptor antagonistic properties and interferes with excessive glutamate. Okay, so and can act as a glutamate antagonist. So dopamine agonist decreases glutamate and that and also NMDA. Decrease NMDA, decrease glutamate and dopamine increase. So where we can use it for moderate to severe dyskinesia. Dyskinesia is disordered movement of this limbs. So 100 mg twice or thrice daily can be given. What are the side effects? Libido reticularis, ankle edema and hallucinations. Why hallucinations? We have discussed one. So what are the other side effects of dopamine increase given? Okay, you know anti-emetic drugs, anti-emesis. Any drug you know which can be used as anti-emetic drug? On them, very good. Then I heard of metoclopramide. Yes, you know where these drugs act? They are dopamine antagonists. That means they decrease the dopamine. That means what? Dopamine in excess can cause hallucination and also vomiting. Okay, so by using the drugs to decrease this dopamine, they are preventing the vomiting. But here it is causing nausea and vomiting. Okay, why? Because increase in the dopamine levels can cause vomiting and nausea, postural hypertension due to hypotension, confusion, hallucinations and sleeplessness. So dopamine level should be low, then only you can sleep nicely. If dopamine levels are more, hallucinations, no sleep. It happens when it will happen examinations. What if I fail? That is one hallucination. Because you have still time to read. Okay, hallucination. That means what has happened? Increased dopamine levels. So that's it. So monoamino oxidase inhibitors. This is an enzyme which breaks down this dopamine in the brain. Okay, so by using the drug which can prevent this breakdown, we are increasing the dopamine level and preventing the Parkinsonism. Delays or reduces the breakdown of this dopamine by MAO-B. So we have MAO-A inhibitor and MAO-B inhibitor. MAO-A inhibitor is clotulin and MAO-B inhibitor is salicylic. So used as monotherapy or in conjunction with levodopa. Okay, when they use in conjunction with levodopa, why? To prevent on and off dopamine with levodopa. So can reduce the dopamine levodopa percentage of drug use. Okay, can be reduced by 15%. So MAO-B is an enzyme that metabolizes dopamine. From breakdown of dopamine, the drug which is released is hydrogen peroxide. Hydrogen peroxide can release free radicals. Okay, you know how hydrogen peroxide kills microorganisms. Do you use hydrogen peroxide? What happens? Foam will come. Why that foam will come? Because of free radical injury to the bacterial cells also and also to the host cell. The one negative point here is in the body, okay, in the normal functioning body, these free radicals are scavenged by the cells. This free radical scavenging is present in the body. As age advances, these free radicals are left to work like that. You know what happens if free radicals are working? The same flow which appears when you apply on the wound can also happen to the cells in the brain. Okay, so this byproduct hydrogen peroxide can be formed by the dopamine metabolism within the brain. What can happen? All the cells will die. Okay. So that's the demerit here. Okay, so hydrogen peroxide is produced with the oxidative stress damage of the dopamine neurons in the substantia nigra. So how this drug can work now? It can prevent the free radical formation is it is neuroprotective agent. Okay. By preventing the formation of these free radicals, this MAO inhibitors such as seligilin, they are acting as a neuroprotective agent. Side effects here is, you know what are the side effects of dopamine agonist? Nausea, vomiting, hallucination and somnolences. Okay. Nausea, dizziness, all these things are there. Then another drug is catechol-4-methyl transferase inhibitor. Okay, it is one more enzyme which breaks the dopamine within the brain. So what are those drugs? Tolcapone and entacapone. Okay, so you saw it in the previous slide. The drugs here are tolcapone and entacapone. So it inactivates and degrades the neurotransmitters such as dopamine formed. By preventing this, it can be helpful to increase the dopamine. It can be used mainly in combination with levodopa. Why we are using the combination? To prevent on and off phenomena with levodopa. Okay, so basically the primary drug which we use is levodopa plus carbidopa. The demerit there is short acting drug. Short acting is what it causes on and off phenomena. So that's it. So delays the wearing of effect. Wearing of effect is something like off phenomena. Reappearing of the symptoms. What are the symptoms? RAD symptoms. What are the RAD symptoms? R for rigidity, A for kinesia, T for tremors. Okay, RAD symptoms will reappear. So COMT catalyzes the methylation of this levodopa. The addition of COMT inhibitor along with levodopa and carbidopa prolongs the half-life of levodopa and increases the amount in CNS. Okay, this increases the on time. On time means decreases symptoms times. So, what are the demerits here? Diarrhea and sleep disturbance. Okay, when dopamine increases in the brain, sleep is disturbed. So, what is drug-induced Parkinsonism? You can now tell me what is drug-induced Parkinsonism. Which drugs can cause Parkinsonism? Where do we use the drugs which will increase the dopamine levels? Schizophrenia. Okay, so schizophrenia is a symptom, is a disease where dopamine levels are very high. Okay, so in this case, what drugs we use which decreases the dopamine levels, and once dopamine decreases, what can happen? Parkinsonism. Okay, that we call it as drug-induced Parkinsonism. The drugs here are which can cause this Parkinsonism are antipsychotic drugs. Where do we use the drugs which can decrease the dopamine? That is antipsychotic drugs. Okay, and antiemetic also. We told that metoclopramide is a drug which decreases nausea, and decreasing the nausea is brought about by decreasing the dopamine level. Okay, so antiemetics, metoclopramide, all these drugs. Okay, metoclopramide these drugs will cause drug-induced Parkinsonism. So milder cases can frequently remit after cessation. In mild cases, once the drug is stopped, Parkinsonism symptoms are decreased. But when you use for chronic schizophrenia for long time, the patient will have this Parkinsonism. So elderly patients are more susceptible. Drugs used are benzexol, benzodiazepine, bupiridine, and also we can use vitamin E preparations. You know, vitamin E preparations are free radical scavenging. They are used as antioxidants. They are used as neuroprotective agents. Okay, vitamin E, what it causes? They are antioxidants. free radicals are absorbed by this particle. So this is summarization of this anti-muscarinic agent or anticholinergic agent which can prevent this rigidity and tremors. Okay. So benztropine, benzexol, chlorosepidine and piperidine. Do you remember what are the anticholinergic drugs? Atropine. What are the side effects of atropine? What is the mnemonic you need to remember? Mad as hatters. Okay, atropine when given, the person will be madly roaming. Okay, I am telling you about the high dose. High dose atropine when given, mad as hatters. Then dry as bone. That means the person's secretion should be decreased. Oral secretion is decreased. Everything is decreased. So it becomes dry as bone. Have you seen the dry bone? It is very dry. Okay. That's why dry as bone. Red as beet. What is red as beet? Cutaneous flushing will be there. The person will become completely red. Okay. We need to remember this. Mad as hatters. Blind as bat. That means what happens in case of atropine is given, what happens? The eyes pupils will be enlarged. The person cannot see what is in front of him. Blurring of vision will be there. That's why we call it as blind as bat. What is bat? Can it see? It cannot see. Okay? How does it work? It transmits sound waves. Okay? By transmitting sound waves, it will see. Have you seen bats? Yes? So many cases I am not telling yes. You know what is bat? It is not a cricket bat. Okay, Batman you have seen. Batman, have you seen that movie? Okay, the small creatures are there. That is bat. They are blind. Okay, their vision is very poor, but they work by sound waves. Okay, that's why we call it as blind as bat. Okay, what are the new things you need to remember about atropine? Mad as hatters, blind as bat, dry as bone, then red as beet. What is beet? Beetroot. Beetroot, which color is it? Red. If you consume beetroot morning, afternoon, night, you will have red color urine. That means what? Why it is happening? Beetroot is so red, it can it is permeable through various tissues. Okay. So that's it. Antimuscarinic drugs. This can be given in drug-induced Parkinsonism, and what are the side effects? I have told you. And this antimuscarinic drugs are also helpful in drooling of saliva. Why drooling of saliva it is helpful? It decreases the secretions, and what we call it? Dry as bone. So that's it. The drug which can be used for decreasing the drooling is one more antihistaminic drug, that is orphanate. And procyclidine is best in drug-induced Parkinsonism. Side effects, you know, confusion, hallucination, dry bone, blurring of vision, constipation, urinary retention, and it can also cause glaucoma. So surgical treatment is there. It is not a pharmacological. Okay, previously they used to try the surgical treatment. Okay, it is a means of last resort. Okay, when all the symptoms are very high, no drug is helpful. No, all the drugs which we have used now, then you can go for surgical treatment. And these are the recent advances in neurosurgical procedures. What they do, one more thing is deep brain stimulation. Okay. So brain pacemakers are good. They will send the electrical impulses to brain to stimulate the subthalamic nucleus where the dopamine nucleus can be there. So you already learned about this, pharmacological, tolcapone. The new methods like sublingual drugs, okay, sublingual racillin, salicylene, and now in case of severe Parkinson's disease, we can give subcutaneous apomorphine infusion where it will help in increasing the symptoms. Newer treatment are in the form of dopamine pumps. We'll revise it once again. Okay.